Good morning, you guys. Welcome back to another video. We're the Acheampong family and we make vlogs about our life in Ghana. We have vowed to you that we share the good, the bad, and the ugly. So here I am with an ugly. I don't really feel like I need to share everything, but since we're a family, I'm taking you along the journey. So, I've been having hemorrhoids since Micah was born. And I don't talk about that with anyone except my mom. But since a week or two, they've been irritating me. And I thought it was time to find a specialist. So I came to LuccaHealth for a professional consultation. And you're coming along with me.
Good morning, Anna. I'm Dr. Fatima, nice to meet you.
Nice to meet you.
Normally I would shake your hand, but in
Yes.
these COVID times, so
yes.
I understand you're here for hemorrhoids, but I want to hear your side of the story.
Okay, so I think I've had hemorrhoids since my son was born. That is about 4 years ago now. And they've been irritating me. So in the Netherlands, I've tried to see the doctor and she said, we should just leave them, it's fine. Okay. But since I came to Ghana, I've not been to a doctor for a very, very long time. So they've been bleeding and I just wanted to see if everything's okay. We're just checking up basically. If that's normal, I don't know. So that's why I came here.
Okay, good. So you'll actually be surprised. Hemorrhoids are really, really common, but it's not something that we talk about day to day.
Yes.
So what a hemorrhoid is, in essence, it's a vein. And we all have them, but a hemorrhoid as such is when the vein gets too large and things happen. Those things can be itching, bleeding. Sometimes they come out, called prolapse in medical speak. Sometimes they come out and need to be pushed back up, and that is a hemorrhoid of more advanced stage. And sometimes they come out and they twist or clot, which can be really, really painful. So in essence, 4 things can happen. What we'll end up doing is after we get some more history from you, we'll take a good look, okay? And then we'll sort of go over the options if that's fine with you, okay?
Yes, of course.
So I'm going to ask you a few questions.
Yes.
When they bleed, do they do so daily?
No, I think it has occurred like maybe 3 days and then it stops.
Okay, all right. Have you noticed during those 3 days you're having more difficulty using the washroom?
No, I didn't really keep an eye on that. But itching, yes, that has occurred. Itching and bleeding, the other 2 things not really. But they are out. Okay. And sometimes it's a little bigger and sometimes it just feels like skin.
Sure. Do you ever have to push them back in?
I tried, yes.
And they come right back out?
I think so.
Okay,
yes.
so there's different types of hemorrhoids. Some are internal and some are external. We'll take a look, okay? External ones, no matter how you try to push in, they will stay outside, all right? And they're treated differently. I'm just going to go to the board a little bit and draw, okay? So we'll sort of means the tail end of the large intestine or the colon, all right? So I'm drawing it as a pipe for all intents and purposes, okay? Again, not something we discuss, which is why there's a lot of misinformation out there, okay? So a hemorrhoid, and I'll draw it in blue, is a vein. It can be external or it can be internal, okay? And they're treated differently. Sometimes the smaller internal ones can be banded. So people come in saying, Doc, I heard about the band, I want the band. Fine. It depends on what style or type of hemorrhoid it is. You can put a rubber band around this, which essentially chokes off the blood supply if it's a small internal hemorrhoid, and then it can slowly die off, okay? If it's an external one, you can't band that. External ones are treated differently. Usually, less is more, so we start with creams, medications, ointments that try to shrink the hemorrhoid. If it's not able to be done, then we move towards something more invasive, like a surgery, okay? Even within surgery or something invasive, there's different ways. You can do a more traditional cutting of the hemorrhoid and stitching it, which I think it causes more patient pain. You can use energy devices like a harmonic scalpel, which is what I use. It's basically a nice device that minimizes pain. It does remove the hemorrhoid, but you don't have to put big, bulky sutures. It leaves the patient a lot more comfortable, and I think it speeds the recovery process. Newer technologies, which are done in certain parts of the world, arterial Doppler, where they find the actual feeding artery of the hemorrhoid itself in the vein, and they basically put a probe in it, and they sclerose it. So in regular terms, they zap it, okay, and it shrinks the hemorrhoid painlessly. We don't do that here, but that is something that can be done if the fit is right. You're asking if this is normal. You know, you'd be surprised. At least 20 to 25% of general surgery patients come in with anorectal complaints.
So even men?
Oh yes, oh yes, oh yes. But this is something that people don't talk about. It is no different than any disease process anywhere. So why it's not normal, it's something that happens commonly, I would put it that way. I think women are more predisposed to having hemorrhoids, especially because of pregnancy. But you do see it in both male and females. Yeah. So in your age group, it's much less likely that it's anything more significant and dangerous. If you do have bleeding from the rectum, in different age groups, we do recommend a more thorough screening, such as a colonoscopy, if needed. For you, it seems like a very tight association with the pregnancy and the bleeding and the itching. These are pretty straightforward diagnoses that we can make just by looking. Okay.
But it's good that I came for a checkup anyway.
I think so. So I think we can do things, even if it doesn't require surgery, there's certainly something we can do to make the situation a bit better.
Yeah.
I find that sometimes even a discussion and educating yourself about it can bring relief.
Yeah. And I'm so happy that I found this place here. When I'm talking to you, it doesn't seem like I'm in Ghana, to be honest. And the hospital looks like I'm in the Netherlands. It's amazing.
Good.
So thank you.
No problem. Any pain there?
A little uncomfortable, but not pain. No, it's just uncomfortable.
No, we're done. All right, so that's it.
Okay.
What I'm going to do is step out of the room and let you change.
Okay.
And then we can continue the discussion, okay?
Oh, that was quick.
Yep, should be quick.
Okay.
So I know you've got some options. I mean, you definitely do have one hemorrhoid. It's moderate sized. Their options would be from starting small to ranging bigger, okay? Starting small, we try to shrink it. We'd give you a 1% steroid-based cream or foam that goes down there. So if we're going to do anything, it has to go from the bottom up. Some people aren't comfortable with that, and that's fine. And that would help shift a bit of the treatment plan towards surgery. This is moderate. I mean, I think you are a decent surgical candidate. How we would do the surgery is same day. That means you come the same day. We take you and we do a safe, either general or partial anesthesia. By partial, I mean you won't remember it. You'll be deeply asleep, but you may be breathing on your own. Or we may opt for a more general anesthesia, which is you completely asleep and us breathing for you by way of a tube. Either way, you're comfortable. We clean the area, we take it, and I use a special device called a harmonic scalpel. I grasp the hemorrhoid and I remove it. So that whole procedure for you would take about an hour. You'd spend about 2 hours in the recovery room, maybe 3, and then you'd be able to go home safely and comfortably. Okay? Recovery is in more or less 3 phases. I would say day 1 to 3. Okay, that's the most acute part. We'd manage your pain with a combination of local anesthetic as well as some pain pills. 7 to 10 days, you'll feel a lot more pain-free, and you'll be getting back to normal. By 3 or 4 weeks, you'll see no bleeding, no itching, and you're on your road to recovery.
Okay. So would I be able to sit during the first, let's say, week or something? Okay.
Yes. I do tell women and men that I'd plan for the first week to be off of work because you want to be in the comfort of your own home. Yeah. You want to be around the familiar surroundings and have privacy and availability to the washroom. Yeah. Okay? Yeah. But you'll be able to sit. We'll have you walking the same day.
Okay. That's something to think about. Wow.
Yeah, it is. What I would do is talk this over with your family and see if this fits in your plans. Again, you have options. Yeah. This is never a surgery that you have to do, and it's important to have that discussion, okay? So if you wanted to start small, let's work together. If you wanted to pursue something a bit more definitive, okay, or permanent, then surgery might be the option.
Okay. And does it affect if I wish to have more children? What is the best option?
Sure. So if you wanted to have more kids, I would say you might want to wait. So one of the things that can happen with hemorrhoids is they can recur, and pregnancy is a significant factor. So if you were planning on having a baby in the next year or 2, I would say wait and do it in one shot.
So if I choose to move forward with the surgery, how does that go with coverage costs, insurance, international, or how does that work?
Sure. Great question. So we do have a financial team that'll work with you, and they will make sure that the insurance process is eased so that portion of your worry is taken care of before surgery. So you can only focus on surgery and recovery.
Oh, great. Okay. That's something to think about. Okay. Thank you very much.
No problem. Thanks for coming.
Oh, guys, I'm so relieved. Dr. Fatma explained the whole process to me, and hemorrhoids is not really something to be worried about. Well, you were there. What do you guys think I should do? Have the surgery or stay with the cream for now? I don't know yet, but I'll see you in the next one. Bye.